As I was preparing for this talk, I came across this quote, which you see behind me, which says that behind every problem, there's a question trying to ask itself. Behind every question, there is an answer trying to reveal itself. Behind every answer, there is an action trying to take place. And behind every action, there's a way of life trying to be born. Please remember the last sentence. It says that behind every action, there's a way of life trying to be born. I'm saying I want you to remember this because this is what I'm going to share with you in the next few minutes. And what I'm going to share with you is what my teachers have taught me. The greatest teachers of my life, my patients. This is something I had to say to one of my patients, Caroline, almost 20 years ago. So I had quite a few conversations with her, and during one of those conversations I said to her, "So you say you want to live." Why did I say this to her? Carolyn was a young lady in her 40s who was diagnosed with advanced breast cancer a few months before that. Advanced breast cancer means cancer which had actually started in the breast but spread to many different parts of her body, including almost every bone that she had. She had decided that she did not want any of the conventional treatments. She did not want surgery, she did not want radiotherapy, she did not want chemotherapy, which are quite standard and which were quite standard at that point in time. She didn't want this because she believed in energy healing and the natural methods of healing, so she didn't want any of this. Unfortunate for Caroline, few months down the line, just before she saw me, she became quadriplegic. So she lost all sensation and movement of the body from neck downwards. So she was actually brought into the hospital, into my consultation room in a stretcher. And we had to look after her. So she was admitted to the hospital, and there were many, many conversations we had with her, finally to convince her to take some radiotherapy to get rid of her pain, and also start her on morphine so that the pain could be controlled. I remember this very distinctly. One day she told me, "Dr. Akhilesh, I want to tell you this. I'm going to get out of this prison." Prison being the hospital. I'm going to walk out of this hospital. When she said that, I didn't say much to her, but I discussed this with a lot of my colleagues. And all my colleagues, including the orthopedic surgeon, said, "Tell her not to risk it. The moment she stands up, she might collapse, and that might be the end of her." Because when we looked at her scans, there was more disease in her bones than bone itself. But she did walk. She not only walked, she drove her car, and she lived a few months after that till the disease attacked her brain, and when she passed on. I'm going to share with you three stories, three patients whom I have seen over the last many years. And why I started looking into this was from Carolyn, this fascinating question of why do patients with such advanced illnesses continue to do the things that they do and continue to amaze us, scientists, doctors, by doing things which we cannot even imagine or science has no answers. But before we go to the patients, let me give you a bit of my own journey so that you understand the perspective from where I'm coming from. My first specialization was in radiation oncology. Now in radiation oncology, you use the latest technology, a lot of equipment to get the best treatments possible, to get the best treatment techniques possible to cure and probably heal the patients. So I used to spend a lot of time on machines, not much with patients. So it was high technology, but low on touch. And then I moved on to specialized in palliative medicine, where it was all about interaction with the patients, building relationships with the patients and the caregivers. And I remember my professor in Oxford, Dr. Robert Twycross, what he said was, when you interact with patients, take off your stethoscope, take off your white coat, and interact with them at a level where you think you're absolutely naked in front of them. And when you think you are naked, and probably the patient also, you feel that she's also actually sharing her heart with you, that's when magic happens. So it's all about relationships in palliative medicine. So I actually moved from something which I call high-tech, low-touch, to a specialty which I call high-touch, low-tech. Many of my colleagues say that this is a very, very odd journey, but to me, it has been an extremely satisfying one. And the reason being the patients that I'm going to share with you. So let me come to the first patient. This man was a surgeon himself, and he actually came to me with his wife, who was an anesthetist. Unfortunately for him, he had developed very advanced liver cancer. So he was in quite a lot of pain when he came to me. So his wife, the doctor herself, his anesthetist, said that, can we deal with his pain first? And then we dealt with his pain. And then she said, can you please also talk to him about not wanting to take the journey to Hajj this year? Because she felt he will not be able to do that. The reason she said that was, over the last 10, 15 years, almost every year he was going to Hajj. And for him, that was his annual pilgrimage, and which he was very, very keen to do. I spoke to him and said that, I don't think it's a very good idea for you to do that. He didn't say much. He said, let me think about it. I didn't see him for more than a month. I didn't know what had happened to him. And then all of a sudden, one day, he was actually wheeled in a trolley to my consultation room. His wife had brought him. He had become extremely weak. He could hardly move. He had become very jaundiced. He could hardly speak. But he was still in a lot of pain. We did something about his pain, and then his wife told me, do you know, we've just come back from Hajj. I was really, really baffled. I looked at him, and he just smiled at me. So the fascinating question of why patients do these things which science cannot explain continued. The second patient I want to talk to you about in Singapore, he used to live in a one-room rental. He was alone. And he was sent to us when he had just about barely 1 year or less to live. He was diagnosed with advanced testicular cancer. Of course, testicular cancer is one of the better cancers that one can have, but he had very advanced cancer, and he was not expected to live for more than a year. Funnily, when we went to see him, his disease stabilized for whatever reason, and then we said, okay, let's bring you to the day hospice so that you can interact with patients, have a bit of a social life, and do some things which are good for you. Otherwise, he would be just spending time in his one-room apartment staring at the four walls. So there he was. He came to our day hospice, interacted, and for almost 3 years, he actually spent time in the day hospice. Still, he had a stroke. So he had left-sided hemiplegia, so the left side of the body was gone. He was not working, and he couldn't speak. So obviously, because he used to live alone, he was hospitalized, and after he was sort of rehabilitated in the hospital, they sent him back to a nursing home. When the day hospice staff went and saw him in the nursing home, he couldn't speak, but the day hospice staff asked him, would you like to come to the day hospice center? He smiled, and a tear rolled down his cheek. So we brought him to the day hospice. With the rehab that we could do in the day hospice, he got better. He could speak a few words. And if you came to our day hospice center one of these days, you'll see him there. This is 6 years after he was told that he has only 1 year to live, after he had an advanced cancer and stroke. My third patient, This guy, he always says he struck the lottery twice. He had a double whammy. He had end-stage heart failure and end-stage lung failure. His heart function was, ejection fraction was 25%. Any ejection fraction of the heart which is less than 35% is considered incompatible with life. So he had a very advanced heart condition, a heart failure, and he also had an advanced lung failure because of his chronic obstructive pulmonary or lung disease. So he was referred to us so that we could keep him at home and prevent this, frequent admissions to the hospital. He used to live with his son, who was a lecturer in the university. He used to spend most of his time alone. So we looked after him at home, and again, when he stabilized, we brought him to the day hospice. He got better until he was found unconscious in his room one day. He was sent to the hospital. There was a tube put down his throat so that he could breathe. But when he came around, he said he wanted to go back home. And then he continued to come to the day hospice till he died a few months later. So this man who had end-stage heart failure, end-stage lung failure, lived for almost 5 years when scientifically we said he probably has less than a year to live. Why do these patients do this? We know in palliative medicine that a lot of patients live if they have looking forward to a birthday, looking forward to the son's graduation or a wedding, and they manage to do that. But if you look at the science behind this, this is something which has been shared by so many speakers before me. You know, it's all what we call psychoneuroimmunology. It starts with your thoughts that has some interaction in the brain, maybe the hippocampus, maybe the hypothalamus, and of course, the endocrines are secreted, which either make you fight or flee. And obviously, it has an impact on the diseases. Either makes it happen or not. Caroline, whom I spoke to you about, and many other patients that I've spoken to, especially breast cancer patients, when I ask them, why do you think you had breast cancer? And the answer I get, probably because of my divorce. Carolyn was going through a divorce at that time when she had the disease. When the husband decided to look after her and they did not have a divorce, her cancer stabilized. But when it affected her brain, it was a different story. So what I'm saying is this, simple as that. You have a powerful thought, put it into a powerful action, and you will have a powerful result. I think this is what most of my patients have taught me. And I think this is what you probably have realized as you go through life. So the quote again, behind every action, there's a way of life trying to be born. I think this is what my patients are telling me every day as I continue my journey with them. Thank you very much.